So today we're going to be speaking about cerebral palsy. An overview of the cerebral palsy is a group of disorders that affects a person's ability to move and maintain balance and posture. Four types of CP is spastic, athoid, dyskinetic, ataxic, and mixed. CP is not fatal, but there is no cure. It is the most common disabling condition seen in children. It occurs in 3.64 per 1,000 live births. The statistics are recent population-based studies from around the world report prevalence estimates of CP ranging from 1 to nearly 4 in 1,000 live births or per 1,000 children in the United States. 1 in 345 children have been identified with CP. CP is higher for children born preterm or at low birth weight. CDC has estimated that the lifetime costs for an individual with CP is nearly 1 million in 2003. Between 1,200 to 1,500 school-age children are diagnosed with CP each year. Boys are diagnosed more often with CP than girls. Over 77% of children with CP have the spastic form. The pathophysiology is that cerebral palsy is defined as a group of non-progressive disorders of movement and posture. It's the most common cause of severe neurodisability in children. Lesions in the various motor centers of the developing fetal brain, interruption of oxygen supply to the fetus or brain. Asphyxia was considered the main causal factor for later CP. However, it has been shown that several ante, peri, and postnatal factors could be involved in the origins of CP syndromes. CP is most often the result of environmental factors.
Next up, we got spastic cerebral palsy. Spastic cerebral palsy is the most common type of CP. The muscles of the people with the spastic cerebral palsy feel stiff, and their movements may look stiff and jerky. It's caused due to injury due to the motor cortex of the brain before, during, or after birth. This results in stiff muscles, which can make movement difficult or even impossible. The effects on the upper and lower limbs with spastic CP. Upper limbs, it may affect one or both arms, leading to flexion at the elbow, wrist, or fingers. These affected areas can lead to difficulties with tasks such as basic ADLs, writing, or even manipulating objects. In the lower limbs, it may affect one or both legs to cause flexion at the hip, abduction or scissoring of the thighs, flexion at the knees. It may also affect a person's ability to stand or sit upright, transfer from one position to the another, or walk and run. Spasticity can also have an effect on speech, can also be present in smaller muscles or muscle groups such as the tongue, facial muscles, or vocal folds. Can also cause slow oral movements that are precise and require a lot of effort. Eating and drinking may be affected, and you may also have slurred speech. The use of alternative methods of communication may be used. Treatment, oral medication is an option, Valium and baclofen, but overall consensus has been shown not to reduce spasticity. Benzodiazepines to relieve muscle stiffness. Surgery may also be a large part of treatment. Selective dorsal rhizotomy. The goal is to relax muscles and improve mobility in various areas. Physical and occupational therapy is also an option.
Adatoid is cerebral palsy, also known as dyskinetic cerebral palsy. It's a movement disorder caused by damage to the developing brain. Type of adatoid CP. Dystonia, slow, rational movement of the torso, arm, legs. Chorea, sudden, involuntary movement, fingers and toes. Ataxia, loss of balance and coordination, and dyskinesia. Cause and risk factor caused by the brain injury. However, each type of cerebral palsy differ based on which part of the brain is damaged. Basal ganglia damage can affect motor function development and causes involuntary movement. Cerebellum damage, balance and coordination become more challenging in damage. Cerebellum can also co-occurring disorders such as autism or epilepsy. Damage to the cerebrum and or basal ganglia can be caused by infection, meningitis, trauma to the developing brain, lack of oxygen to the developing brain, risk factor, premature birth, severe infantility, jaundice, and blood clotting in the placenta. Symptom of anti-CP is based on severity of the condition, location, movement, tissue, or a result problem with both high and low muscle tone, involuntary movement, tremor, poor posture, unsteadiness, twisting of the torso, and grimacing or drooling. Treatment of cerebral palsy. Physical therapies work with children and adults to overcome sensor impairment, focus on improving overall mobility. Occupational therapy is used to enhance a child's ability to independently play and learn. Speech therapy surgery is not common in CP, but can be used to correct joint deformity and dislocation due to high muscle tone.
Next up is ataxic cerebral palsy. Up to 10% of children with CP are diagnosed with the ataxic type. Ataxic cerebral palsy inhibits balance and coordination. Developmental disorders that affect motor function. It's characterized by problems with balance and coordination caused by damage to the developing brain motor control centers. Children have a hard time controlling their movements. They often at times have shaky and struggle with their precise movements, and it can affect the hands, arms, legs, feet, eyes, and speech. Cause and risk factors. So caused by a brain injury to the cerebellum before, during, or shortly after birth. The cerebellum is essentially uninhibited motor function, as it is central to regulating balance and coordination commands from other parts of the brain. Damage caused from infections in the womb, loss of oxygen from placental failure or breech birth, head trauma during or after birth, brain hemorrhaging from fetal stroke. Risk factors: the mother who has poor maternal health, or children who have been victims of abuse have higher chances of developing ataxic CP due to possible brain injury. Signs and symptoms. The primary symptoms of ataxic CP are problems with balance and coordination and motor skills, imprecise motor skills, trouble walking, balancing, issues with depth perception, tremors, and shakiness. Secondary symptoms: troubles with vision and hearing due to the damage to the cerebellum. However, doctors usually hesitate to make a diagnosis until at least 18 months of age to ensure an accurate diagnosis. Developmental signs of ataxic CP versus walking with feet spread far apart, trouble bringing hands together, unsteady gait, trouble grasping objects, slow eye movement, and struggling with speech. So treatment: physical therapy and occupational therapy are some of the main treatments to help children become more independent later in life. PT combines strength and flexibility exercise with massage therapy and orthotic devices. Their goal is to help children manage their movement problems and become more independent. OT focuses on improving problems with balance and coordination. Speech therapy, use of articulation therapy, breathing exercises, and word association to help the child to better communicate. Some medications is generally used as supplement to physical therapy. Those would be muscle relaxants and anti-anxiety medications such as Valium, which may calm shakiness and tremors.
Next, we got mixed cerebral palsy. With mixed CP, a child exhibits symptoms of more than one type of cerebral palsy. Children diagnosed with mixed type will have sustained damage to the motor control centers in several parts of the brain. Mixed type is the second most common form of the condition. Most common types of mixed are spastic athioid and spastic ataxic. Some causes and risk factors. The main cause of mixed CP is injuries to various motor control centers of the developing brain. Brain damage caused by infection before birth or after birth, lack of oxygen, stroke suffered during birth, toxic poisoning such as methylmercury, traumatic head injury in the first year of life. Risk factors: severe jaundice, placenta failure, perinatal or maternal infection, bleeding in the brain. Types of damage associated with mixed CP. Damage to the motor cortex causing spastic in the muscle, joints, and tendons of spasticity. Damage to pyramidal tracts can cause the motor cortex to unsuccessfully transmit signals to the pyramidal tracts, causing mobility issues. Damage to basal ganglia, involuntary movement, lack of muscle control, and fluctuating muscle tone.
All right, so now some symptoms of mixed CP. Symptoms may vary depending on the child's unique diagnosis. The main signs are issues with movement, imbalance, and lack of coordination, abrupt or convulsive movements. Other symptoms include abnormal reflexes, exaggerated jerky movements, issues with coordination, poor posture, tremors, or shakiness. For treatments, there's physical therapy, uses the strength training, flexibility exercises, massage therapy, and assistive devices, such as aquatic and equine therapies. Occupational therapy improves motor control and bilateral coordination by using games, toys, and books. Goal is to help them become more independent in daily life. Speech therapy uses language skills, word association, articulation therapy, jaw and breathing exercises to improve oral skills, medications such as anticonvulsants, nerve blocks, antidepressants, and muscle relaxants. Surgery can be beneficial for children with severe athetoid CP symptoms, as well as children with spasticity to relieve painful contractures and improve overall movement. Nursing care for children with CP assists the child in making the most of their assessed and guide them into being well-adjusted adults, create short and long-term goals, management of pain, dental hygiene, educating families to community resources, supplementations for children that they may have feeding problems such as vitamins, minerals, and protein supplements, multidisciplinary approach to care such as PT, OT, and speech therapist. And then this is our list of references.